Okay. All right, so welcome. My name is Linda. I'm from the Upper Saddle River Library, and I'd like to give a big welcome to Jennifer Shukaitis. Hope I did that right again. I stumble with words.
Got it.
Perfect. And she's an MPH. She's coming to us from Rutgers Cooperative Extension. This is the Family and Community Health Sciences. And we're really excited. She's been here before, and we're very happy to have her back and to talk about something that I think, since I had my first bone density test, they wanted to give me a baseline. This is something that I think a lot of us are, I'm definitely interested in. As I was saying before, I am gonna mute everybody to get this program. When we start the program, Jennifer will go through her slideshow. There is a chat box at the bottom. If you have questions you want to chat me, I can ask the questions. Or as Jennifer said, you know, we could open it up at the end for a couple of the questions and answers at the end. You could unmute yourself. We'll let you know. If you do really have a question in the middle, you want to unmute yourself, that's okay too. We're not that strict of a group. And with that, I think I'm going to let Jennifer take it away.
Thank you, Linda. Good afternoon, everyone. As Linda just said, my name is Jennifer Shukaitis, and I am faculty at Rutgers in Rutgers Cooperative Extension. And before we get into the meat of our program today, I wanted to just tell you a little bit about Rutgers Cooperative Extension in case you are not familiar with it. So Cooperative Extension is actually a national system. There is a Cooperative Extension in every state. I think a couple states actually have two. What it is run out of the land-grant university in each state. So in New Jersey, that happens to be Rutgers. And cooperative extensions were established 100 years ago to be the bridge between the university and the community. So, 100 years ago, we didn't have smartphones and Google and all this information right at our fingertips. And even though we still do, right now we do have smartphones and Google and all this stuff so readily available, sometimes it can be hard to know what information is actually good, reliable, evidence-based information and what is not. So the cooperative extension is our mission, our goal, our purpose is to be a resource for the community to bring all of the latest research and information that's evidence-based, research-based to the community. We are funded by Rutgers. We are a resource that is provided by the university. So the services that we offer are free or sometimes very low cost depending on the program. We are county-based, so there are cooperative extension offices in every county. And there are three main departments in cooperative extension. There is agriculture, which they work really primarily with the farming community, as the name might suggest, but they also are available to anyone who has any questions about gardening. If you find some sort of pest on your vegetable garden in the summer, you don't know what it is or how to deal with it, you can call your extension office and they can help you figure it out. Again, free or very low cost services. 4-H is the other department in cooperative extension. I'm sure probably everyone has at least heard of 4-H, that's the youth development department. If you've been to the county fair in your county or another county, that is run by 4-H. And then finally, there's my department, which is Family and Community Health Sciences. And my department is focused on nutrition and health education and information. So a lot of what I do is what I'm doing right now. Normally, under normal circumstances, I'd be doing this in person at the library or any other community centers. But we have adjusted for the times. And so I'm here to bring you some information. Today, we are going to be talking about healthy bones for a lifetime. Okay, so we can get started. Let's see, we have about an hour today. I have a very dense program today. I have a lot of notes here, so if I'm looking down, it's just because I have a lot of things written. I don't want to forget anything. This is being recorded, so you don't have to worry too much about scribbling notes down or anything. You'll be able to go back and watch the recording. I'm also happy to share these slides if Linda wouldn't mind emailing them out later. And I'll also be sending follow-up resources. So you'll have all that information at your fingertips later. So just wanted you to know.
Great, and thank you. And I will send that out to the group afterwards.
Okay, great. Thank you, Linda. Okay, so let's just talk about the objectives for today, what we're going to be talking about and learning. So first I'm going to define osteoporosis. I'm going to outline the risk factors for osteoporosis, identify screening guidelines, explore dietary and lifestyle measures that can support strong, healthy bones, review treatment recommendations for osteoporosis. We're going to talk about fall prevention strategies. I actually give a whole workshop just on fall prevention, so I'm going to do it very briefly today, but just to give you a very brief introduction to it. Okay, so osteoporosis. So osteoporosis is a disease where decreased bone strength and mass significantly increase the risk of fractures. And today we'll discuss the causes, symptoms, and risk factors related to osteoporosis. We will explore who should be screened for osteoporosis. We'll learn lifestyle and dietary measures. And we'll review some current treatment options and like I said before, fall prevention strategies. So osteoporosis means porous bone and is characterized by low bone mass, deterioration of bone tissue, and disruption of bone architecture. That's a lot of maybe confusing terms. I will clarify what those mean as we go. Okay. So less than optimal bone growth during childhood and adolescence can result in a failure to reach optimal peak bone mass. So peak bone mass attained early in life is an important factor affecting your risk of osteoporosis in later years. So people who start out with greater reserves of bone, in other words, higher peak bone mass, are less likely to develop osteoporosis when bone loss occurs as a result of aging, menopause, or other factors. Other causes of osteoporosis are bone loss due to greater than expected rate of bone resorption. Again, I'm going to go over what all these terms mean. A decreased rate of bone formation, or both. So I know that we tend to start to worry about or think about bone health as we get later in life, but it's important early in life, if you have kids or grandkids, to pass this information on to them as well, so that they understand that really getting their optimal bone growth early on in life is something that can be a preventive measure too. So osteoporosis is a disease marked by reduced bone strength, leading to an increased risk of fractures or broken bones. Bone strength has two main features. Okay, there's bone mass, which is the amount of bone, and bone quality. So these two together equal bone strength. Okay, osteoporosis is the major underlying cause of fractures in postmenopausal women and the elderly. Fractures occur most often in bones of the hip, the spine, and wrist, but really any bone can be affected. Some fractures can be permanently disabling, especially when they occur in the hip, as you may know. Osteoporosis is often called a silent disease because it progresses without any symptoms very often until a fracture occurs, or one or more of the vertebrae, which are the bones in your spine, collapse. So collapsed vertebrae may first be felt or seen when a person develops severe back pain, loss of height, or spine malformations such as a stooped or hunched posture. Bones affected by osteoporosis may become so fragile that fractures occur spontaneously or as a result of very minor bumps or falls or normal stresses or strains such as bending, lifting, or even coughing or sneezing. And I think there's a sort of a common understanding, I think, or idea that osteoporosis is really a natural or unavoidable part of aging. However, medical experts now are seeing more and more that osteoporosis is largely preventable. And furthermore, people who already have osteoporosis can take steps to prevent or slow further progress of the disease and reduce their risk of future fractures. And although osteoporosis was once viewed as primarily a disease of old age, it is now recognized as a disease that can stem from less than optimal bone growth during childhood and adolescence, as well as from bone loss later in life, as I had mentioned before. So it's important to get that, to do things to optimize your bone growth earlier on in life as well. Okay. Okay, so what we're looking at here is the hip joint, okay? The bones of the hip joint or the neck of the femur. So when you look under a microscope, the bone on my left and your left, that's a healthy femur bone. Okay, the little rectangular box there, that's the what it looks like when you get really close up, highly magnified. That's a healthy bone, okay? On the left, and on the right, the hip bone is that's a bone with osteoporosis already forming. Okay, and as the bones become more porous and fragile, as you can see, there's lots of pores there. The tissue is less connected. So when the bones get to that point, the risk of fracture is greatly increased. Okay, the loss of bone occurs silently and progressively. We don't feel it happening, and often there are no symptoms until a fracture occurs. You can see that the neck of the femur bone there, oftentimes in much older adults with low bone mass, and they may suffer a fall due to the femur bone breaking first. Okay, so it's sometimes the break is not the result of the fall, but actually the cause of the fall, if that makes sense. Okay. So what we see here is the bone remodeling cycle. Okay, your bones are continually being remodeled. This process takes about 4 months to complete. On the left, you'll see there, the process starts with the osteoclasts or the bone clearing cells. Okay, the osteoclasts clear away the old bone, and through the process of the osteoblasts, the bone building cells, begin the process of laying down new bone cells, as you can see on the right. As you age, the adult body can take 7 to 10 years to replace all bone cells. And as we continue to age, your body becomes less capable of replacing the cells that were lost, and the bones become thinner. Bone loss is normal, but not everyone will develop osteoporosis. Okay? And many things can affect this process. We'll talk more in detail about this later, but some of the things are your calcium intake, vitamin D intake, physical activity, medications that you're taking, smoking, and excess alcohol consumption as well. Okay, so just some numbers here. In the United States, more than 2 million broken bones are caused by osteoporosis each year. Studies show that half of all women over the age of 50 and a quarter of men will break a bone in their lifetime due to osteoporosis. In the US today, more than 54 million people either already have osteoporosis or are at high risk to develop low bone mass. Osteoporosis can occur at any age, although the risk for developing the disease increases as you get older. It's most common in non-Hispanic white women, but the disease affects many older Americans of any race or sex. And osteoporosis can really take a toll in terms of reduced quality of life for many people who suffer from fractures. All right, I mentioned this before, but it is an important point that osteoporosis is often called a silent disease because we don't know that it's happening. We can't feel it. And early screening and detection are really critical to understand if you have it or are at risk for it. You don't want to wait, to get a fracture. Fractures often result in decreased quality of life and limited mobility, especially the older you get. Okay. Many people aren't aware that they have osteoporosis until they either have a bone densitometry test, which is also called a DEXA, D-X-A. Talk more about that in a minute. Or if they have a minor fall, which then causes a fracture, a bone to break. Okay, and that's why early detection is so important. Okay. What we see here is a list of what are called non-modifiable risk factors. So there are risk factors for, well, any disease or any condition. And there are two different categories of risk factors mainly. And so what the one category is non-modifiable risk factors, which are the things about you individually that you cannot change, you have no control over. The modifiable risk factors are the things that you can change, that you can, have some control over. So first, we're going to review the non-modifiable risk factors for osteoporosis. So the things that you cannot change, right? So those are your gender, excuse me, your age. You cannot change your age. So age over 50 years, especially for women, is a risk factor for osteoporosis. Early menopause or experiencing early menopause or being postmenopausal, that's a risk factor for osteoporosis as well. Your genetics and ethnic background, family history of osteoporosis. If you have it in your family, you are more likely to develop the disease yourself. If you have a history of fractures, certain medical conditions, which may then lead to medications that you're taking. Some medications can increase your risk for osteoporosis. Physical inactivity and low body weight, being very small and thin is actually can increase your risk factor for osteoporosis. Women have a greater risk factor for osteoporosis than men because of a marked decrease in estrogen levels. Estrogen provides a protective effect on our bones. Accelerated bone loss begins 1 year before the occurrence of menopause and lasts for approximately 3 years. Some women can lose as much as 20% of their bone mass in the first 5 to 7 years post-menopause. Some medical conditions that can contribute to osteoporosis are celiac disease, inflammatory bowel disease, kidney or liver disease, cancer, and rheumatoid arthritis. And medications that can contribute to osteoporosis, some of the most common ones are prednisone, phenobarbital, anti-epileptic medications, and some drugs used to treat cancer. This is not an exhaustive list. I can't, list every single medication here or risk factor. So if you have a concern or a question about any of your personal health conditions or your medications, you should talk to your doctor or your pharmacist to ask about those risk factors. Now here we have the modifiable risk factors. These are the things that you do have some control over and can change, okay? So calcium consumption, right? We have some control over that. You can increase or decrease your calcium consumption as well as your vitamin D consumption. Calcium and vitamin D are friends, okay? When you have to take them together because vitamin D helps your body to process calcium. Physical activity. So the types of physical activity that really help to strengthen your bones are weight-bearing activity, walking, and resistance exercise using weights. Okay, losing too much weight is a risk factor that you have some control over. Smoking, alcohol consumption, 3 or more alcoholic drinks per day does increase your risk for osteoporosis. Not eating enough fruits and vegetables. Getting too much sodium and caffeine, and being inactive, okay? Let me see, yep. Okay, low bone mass. So low bone mass is when our bone density is lower than normal, but not low enough to be considered osteoporosis. So low bone mass is also called osteopenia. Does not mean you'll get osteoporosis, but it is a risk factor. And as we age, we lose more bone than we replace. It takes longer to replace that bone too. And people with low bone density are more likely to break a bone compared to those with normal bone density. Osteoporosis is associated with some male-only conditions, such as abnormally low testosterone levels. Men have fewer prescription choices available to them, as most of the available medications have only been tested on women. Then starting at about age 65, however, both sexes lose bone at about the same rate. Okay. So a bone density test, who should have one? These are the people who are considered to be at risk for lower bone density and should consider having having a bone density test. So women who are age 65 or older, men age 70 or older, postmenopausal women and men ages 50 to 69 with clinical risk factors. Again, that's something you can discuss with your doctor to figure out if you have those clinical risk factors. Adults who have had a fracture after age 50, and adults with a condition such as cancer, lupus, or rheumatoid arthritis that may increase your risk for osteoporosis. Or if you're taking a medication, like one of the ones that I listed before, like prednisone, that's associated with low bone mass or bone loss that can increase your risk for decreasing bone density. Let me just check my notes here, make sure I didn't forget anything. Okay. Oh, just a note, if you should also ask your doctor about osteoporosis if you notice that you have lost height or your posture has become stooped or hunched, or if you experience sudden back pain. That can be an indication of one of your backbones having broken or chipped. You may also want to be evaluated for osteoporosis and fracture risk if you have a chronic disease or eating disorder known to increase the risk of osteoporosis, or taking one of the medications that is known to increase your risk for osteoporosis. And if, again, I listed those before, but if you're not sure, ask your doctor or your pharmacist. Okay, so I mentioned who should have a bone density scan. So now we are going to talk about bone density scans and what they are like. So a bone density scan is an enhanced form of X-ray technology that's used to measure bone loss. DEXA, that's the shortened version of bone density scan. DEXA is the established standard for measuring bone mineral content. You don't have to change your daily routine for a test. The doctor's office will probably ask you not to take a calcium supplement for about 24 hours before you have a DEXA scan. They may also ask you to not wear metal or certain things on the day of, but nothing major to prepare for a bone density scan. A DEXA scan will measure the bone mass in your spine, your hip, and sometimes in your wrist. The amount of radiation from a DEXA scan is minimal, and the technician can stay in the room during the test. Okay, so what do these tests actually measure? What do they tell you? The result of this test is you would get what's called a T-score. A T-score represents the extent to which your bone density differs from the average bone density of young, healthy people. If you're diagnosed with osteoporosis or very low bone density, or if your bone density is below a certain level and you have other risk factors or fractures, the doctor will talk to you about options for treatment or prevention of osteoporosis. Okay, so the T-score. The T-score of -1 or above is considered normal bone density. A T-score between -1 and -2.5 means you have low bone density or osteopenia. Examples are T-scores of -1.1, 1.6, 2.4, all between -1 and -2.5. A T-score of -2.5 or below, that indicates a diagnosis of osteoporosis. So we talked about some of the modifiable risk factors before. Those are the things that you can change and have some control over. So one of those things is calcium. So we're going to talk about calcium now and how much you should have. The amount of calcium that we need to consume changes at different stages of our lives. So with age, the body's ability to absorb calcium declines, which is one of the reasons why older adults require higher amounts of calcium. Calcium intake is essential to promote bone health. The Office of Dietary Supplements recommends the following amounts of calcium for your age and your sex. So between ages 19 and 50, males and females both need about 1,000 milligrams a day. Males between ages 50 and 70 need 1,000 milligrams. For females, it's a little higher, 1,200. And at over 71, both males and females both need 1,200 milligrams per day. Okay. Caffeine and salt can increase calcium loss also from the body and should not be taken in excessive amounts. We can take in calcium from our diet and lose it from the body mainly through urine, feces, and sweat. The body depends on dietary calcium to build healthy new bone, and this is why we need to consume the recommended daily amount. The upper limit of calcium intake is 2,500 milligrams. You don't want to go above that. Then you can get calcium deposits and that leads to other problems. So you want to really stay under 2,500. And then other than that, follow the recommendations that you see here. Again, you'll be getting these slides and information following this. So you'll have this information available.
And again, this was a daily number.
Mm-hmm.
It says so on the, yeah, on the top.
Yes. Yes. Thank you. Okay. And the best way to get calcium is really through the diet, as opposed to, you know, supplements are good, but the best way to get calcium or any nutrients actually is really through food. Okay, so that leads me to calcium-rich foods. Okay. So as I said before, dietary consumption of calcium is the preferred way. Your body likes food. Your body, you know, we are meant to absorb food. We are meant to absorb nutrients through food. That is really food's, you know, primary function, although it does taste delicious as well. It's meant to keep us healthy. And so while supplements are good, they are meant to supplement our diet, getting calcium through food and other nutrients as well really is the most effective way. Okay, so you want to aim for calcium at each meal. All right, some calcium-rich foods, which have 200 milligrams per serving or more, include dairy products, which I'm sure we all know those are some calcium-rich foods. So milk, we want to, you know, we always encourage low-fat milk to avoid too much saturated fat in the diet. Low-fat milk, low-fat yogurt, low-fat cheese or part-skim cheese, and cottage cheese. Sardines, which are very calcium-rich, tofu, and then fortified foods. So for example, orange juice, you'll sometimes see, you know, you can buy certain brands of orange juice that are fortified with calcium. Fortified means that it's the nutrient has been added to a food that doesn't naturally contain that nutrient. You'll see on certain foods, there's fortified and then there's enriched. So enriched foods have nutrients added to them that they already have, but they're adding even more. Fortified is something that does not occur naturally in the food, but is added to it to help ensure that people are getting enough of it. Okay, so collard greens, I have frozen there. I don't know why I specifically said frozen. I guess because sometimes they're hard to find, but they're easy to keep in the freezer. Broccoli rabe and some legumes like garbanzo beans. And I'll be sending also a resource that has a list of calcium-rich foods. So again, you'll get that at the end. And so if you're looking to add to your shopping list, you'll have that handy for later.
And there was a question about, is there too much caffeine? Or I don't know if that's going to be a little later in the program, but is there, what's
yeah, I did, let's see.
I'm sitting home drinking a lot more coffee.
I'm sorry, say that again?
As we're now all sitting home, you go through the list and I'm like, oh, post-COVID restrictions, drinking too much coffee.
Oh yeah, well caffeine, you know, is a diuretic, and so that can actually strip the bones of certain nutrients. So again, a cup a day, 2 cups a day is not going to be have a major effect. But if you're someone who, you know, drinks coffee throughout the day, you know, the recommendation is to try to cut back to maybe 1 or 2 cups a day. Yeah, because excessive caffeine intake can actually have, you know, negative effects on a number of health factors, including our bone health, yeah, and calcium loss. So you can determine the amount of calcium in a food by reading the food label. Those food labels are so wonderfully chock full of so much information. Some greens, like collard greens, are also high in vitamin A, vitamin C. So these are all foods that are also generally very beneficial for your health anyway, including being high in calcium. So when it comes to calcium supplements, again, obviously, you know, food is the preferred way to get your calcium, but it's, you know, not always easy to ensure that you are getting enough. And so supplements are a way to support your calcium intake on a daily basis. Okay, so calcium carbonate contains 40% calcium and should be consumed with food. Okay, let me back up for a second just to explain what these mean. All right, so calcium supplements, they come in a variety of formulations and vary in the elemental calcium content. Okay, calcium supplements contain calcium in a variety of molecules such as calcium carbonate, calcium citrate, or calcium citrate malate. Okay, each supplement supplies a different amount of calcium. These are the most commonly available. Okay. To maximize your absorption of calcium, calcium supplements should not exceed 500 milligrams per dose. Okay. So additionally, calcium carbonates, which contains 40% calcium, should be consumed with food. Calcium citrate contains 21% calcium and can be consumed with or without food. Calcium citrate is preferred with older adults and those taking proton pump inhibitors like Nexium. Okay. I cannot tell you what the best calcium supplement for you is. You will have to talk to your doctor or your dietitian or your health professional to determine what the best supplement for you is. Okay. Let's see. Calcium carbonate's absorption is a pH dependent on the level of acid in the stomach. Older adults tend to have a decreased acid as they age, and therefore calcium citrate tends to be the preferred in elderly patients. The back of the calcium bottle will tell you if it contains calcium carbonate or calcium citrate. And pharmacists can also discuss potential drug interactions and other medications. So in general, it's preferred for older adults, but you'll want to talk to your doctor about that too, just to make sure that you're taking the best option for yourself.
And then there was a question of what is elemental calcium?
Yeah, it's just on the elemental level. Going back to chemistry, you know, it's not really that important. It's just, you know, the differences are on that level. That's all that means. Yeah. Vitamin D. You'll often see that, that milk is fortified with vitamin D. The reason for that is milk or other, you know, dairy products are calcium-rich foods, and vitamin D is necessary for calcium absorption. So if you're taking all this calcium, but you're not getting, you know, sufficient or any vitamin D in your diet, it's really not gonna do you much good. Okay. So the Office of Dietary Supplements recommends the following for adults ages 19 to 70 years, both males and females. 600 international units. That's just the measure that is used for certain supplements. And adults ages 71 and over, again, both male and female, 800 IU. And it'll say right on the bottle what the IU is. It's usually very clear right on the front. So calcium and vitamin D work together to protect your bones. Calcium helps build and maintain bone, and vitamin D helps your body effectively absorb calcium. Yeah, and like I said before, even if you're taking enough calcium, it could be going to waste if you are deficient in vitamin D. It's helpful to talk to your doctor or your other health provider about having a blood test to determine your level of vitamin D. Okay. These are the recommended amounts. The upper limit of vitamin D is 4,000 IU. So you don't want to go, some people, you know, there's this idea, if I take more vitamins, I'm being, or more supplements, I'm being extra healthy, but there is such a thing as too much of a good thing. You don't want to overdo it. So that's the upper limit for vitamin D, 4,000 IU. So where do I get vitamin D? As I said before, vitamin D plays an important role in calcium and absorption and in bone health. The precursors of vitamin D are present on your skin. And regular sun exposure is the most natural way to get enough vitamin D. So you want to aim to get about 10 to 20 minutes of morning or afternoon sun a few times a week. It can also be obtained through the diet, but sun is really the best way to do it. This is sort of a little bit at odds with the recommendations for wearing sunscreen, because the best way to absorb the sunlight is to do so without sunscreen, because that's, you know, the most direct way your skin will be able to absorb it. I am someone who is very fair, so I, you know, tend to really, you know, be strict with the sunscreen, but it is important if you can just get for a few minutes each day, not to the point where it's going to be harmful. It's harder at this time of year. I know that we have less sunlight, it's colder out. We don't, you know, we're wearing things that cover our skin. But if you can get a few minutes of sunlight a day, it really, really does help to help your body to produce that vitamin D, which it really, really needs. So vitamin D can also be obtained through the diet. Not many foods are actually very high in vitamin D, although many people are able to obtain enough vitamin D naturally. Vitamin D production does decrease as you get older. So in the elderly, it's especially low. We also see low levels of vitamin D in people who are housebound, don't get enough sun, and in some people with chronic neurological or gastrointestinal diseases. These individuals and others who are at risk for vitamin D deficiency may require vitamin D supplementation. The recommended daily intake of vitamin D is 600 IU for adults and up to age 70 and 800 for people over 70. Okay. Often it's difficult to get enough vitamin D from food, oral supplements, or some from food or oral supplements. That's why sunlight is recommended. There was a recent research article that suggested that a few minutes of sunlight each day to the face, neck, and arms are all that is necessary to restore vitamin D deficiency. But again, this can vary greatly in individuals based on a number of risk factors, just, your body's ability to absorb the vitamin or the sunlight, our age, a number of things. But getting that few minutes certainly wouldn't hurt. Okay. Just checking my notes here, making sure I didn't leave anything out. Okay. Oh, I didn't talk about, right. So, so again, if you're concerned about, skin cancer risk, you could also aim to get your vitamin D through your diet. So some vitamin D rich foods are fatty fish. So for example, salmon, tuna, and mackerel. And the fat that's found in fish is the healthier fats. So I know I say fatty fish and that might sound like it's not nutritious or not healthy, but those are the heart healthy fats that are found in those fish. And in vitamin D fortified foods like milk, cereal, and juice, you can take a supplement. The most commonly preferred supplement is D3. Okay, just bear with me while I make sure I didn't forget anything here. I wrote everything down. Okay. Okay, so this is talking about the body's ability to absorb sunlight and how long it takes. So an example, at noon in Miami, sunny place, someone with the type of skin that might burn and then tans would require about 6 minutes to synthesize 100 IU of vitamin D in the summer. In the winter, that increases to 15 minutes. Someone with darker skin that rarely burns and tans easily would need 15 minutes in summer and 29 minutes in winter. In winter, the sun exposure would need to be much longer, like an hour per day. And after 2 p.m. in the winter, it's possible for someone to receive enough sun equal to 400 IU of vitamin D. Okay. You cannot reach high blood levels of vitamin D through diet and sun exposure alone. So those upper limits that I talked about before. Okay, if a blood test shows that you are deficient in vitamin D, your health provider, so your doctor, dietitian, etc., will assist you with vitamin D supplementation to get your vitamin D levels to a normal range. Many experts recommend a blood level of 25 hydroxyl vitamin D, and blood levels less than 12 would indicate a vitamin D deficiency. Okay, I'm just doing a time check here. Okay. We'll still have a few minutes for questions at the end. Okay, so physical activity. Physical activity, weight-bearing activities especially, are very important to maintain healthy and strong bones throughout the lifetime. So like muscle bone is living tissue. I know we think of it as being something that's sort of hard and, I don't know, stationary or inactive, but it's actually living tissue that responds to exercise. It can get stronger with exercise. And there's a lot of evidence that physical activity early in life contributes to higher peak bone mass. So can, encourage your kids, grandkids, et cetera, to stay active. It really, really can have such important effects on their health long-term. It's funny that the other end of that is that excessive physical activity can actually be bad. That can actually increase your risk for injuries, et cetera. But that's really to an extreme level. So the best exercises for building and maintaining bone mass are weight-bearing exercises. So exercises that you do on your feet that forces you to work against gravity. Weight-bearing exercise include jogging, running, aerobics, hiking, walking, stair climbing, even gardening, okay? Tennis, dancing, anything that really gets you moving like that. Depending on your age, high impact exercises may provide the most benefit. Bicycling and swimming are not weight-bearing exercises, but they have other health benefits. So it's not saying you shouldn't do those things. They can be great for cardiovascular health, et cetera, but they're not considered weight-bearing. I get those questions a lot with biking and swimming. So exercise machines that provide some degree of weight-bearing exercise include treadmills, because you can walk or run on a treadmill or jog, stair climbing machines, ski machines, and exercise bikes. Strength training to build and maintain muscle mass exercises that help with coordination and balance are also important. As we get older, balance can be especially important in preventing falls. So a properly designed exercise program that builds muscle and improves balance and coordination provides other benefits for older people, including helping to prevent falls, maintaining overall health and independence. Experts recommend 30 minutes or more of moderate physical activity on most, preferably all, days of the week, including a mix of weight-bearing exercises, strength training 2 or 3 times a week, and balance training. All right, so what you see here, this chart that I have up for you here, just a little chart to help you understand what exercises, how they're benefiting you, what type of exercise they're considered. So weight-bearing exercise, what is it? Bearing your body's weight on your feet and legs as your muscles and bones work against gravity. Okay, so you have to lift up your leg to move. I mean, so that's working against gravity. So examples: walking, aerobics, dancing. Recommended amounts, total of 30 minutes, most days a week. And the benefits are improving your balance, which may reduce your risk of falling and therefore breaking bones. And then muscle strengthening exercises, moving parts of your body, weights, or other resistance against gravity. These can be done with free weights, weight machines, and elastic exercise bands. I know a lot of us are working out at home these days. A lot of these things really can be done pretty easily at home. You don't need an expensive gym membership or fancy gym to get a lot of these types of exercises in. I'm sorry, I lost my spot there. Muscle strength exercising. Okay, so these work each major muscle group. You want to do that 2 to 3 days per week. The benefits are they make your muscles stronger. That can help to prevent falls, and also to prevent fractures by preventing those falls as well. Okay. So you don't need a stair machine at home. You can just walk up the stairs. If you have stairs in your house, go up and down a few times. Might feel silly at first, but you get used to it. And a lot of the equipment is really very inexpensive as well. So exercise bands, just small free weights. Those are all things that you can do at home. There's so many great resources out there that a lot of them are free too. That you watch YouTube videos to do certain exercise routines and things. I know it helps when I have something to follow along with and look at. If I do it by myself, after 5 minutes, I'm like, oh, hasn't it been, oh no, it's only 5 minutes. Okay. I should keep going. But if you're following along with somebody, it can help to keep you on track and make sure that you complete, an actual decent amount of time with that activity, and also to do it properly. The treatment for osteoporosis. Osteoporosis cannot be reversed or healed, so to speak, but there are ways to manage it. Some of those methods are things you can do every day through just nutrition and physical activity. The primary goal in treating people with osteoporosis is preventing fractures. A comprehensive treatment program includes a focus on proper nutrition, exercise, and prevention of falls that may result in fractures. Your doctor also may prescribe one of several medications that have been shown to slow or stop bone loss or build new bone, increase bone density, and reduce fracture risk. If you take medication to prevent or treat osteoporosis, it is still essential that you obtain the recommended amounts of calcium and vitamin D on a daily basis. Exercise and also maintain other aspects of a healthy lifestyle. That's also important. So not smoking, not drinking to excess, reducing your caffeine consumption, all those things remain important even if you're on the medication. Okay. These are just some of the commonly used prescription medications. So there's Fosamax, which is a weekly pill. That's a newer one. Actonel and Atelvia, that's a weekly or a monthly pill. Boniva, monthly pill or quarterly IV infusion. That's generally done through a home visit or a doctor's office visit. Reclass and Zometa, those are annual yearly IV infusions. Forteo's daily injections, Prolia daily injections, and Evenity monthly injection at the doctor's office. Just doing a time check here to see how we're doing. Okay. Falls prevention. And like I said before, I had this falls prevention. I have done an hour workshop just on this topic. So this is a very brief introduction to fall prevention. There's a lot that can be done to prevent falls. So these are just a few things to let you know that falls really, there's a lot that can be done to prevent them. So you want to wear supportive shoes with rubber soles and low heels. Use handrails on stairs and escalators. Be careful around pets in the home or when walking outdoors. Fall prevention is really critical for men and women with osteoporosis, without as well, but even more so for those with osteoporosis because their bones are more prone to fractures. Falls increase likelihood of fracturing a bone in the hip, wrist, spine, or other part of the skeleton. Fractures can have a significant effect on your quality of life and lead to the loss of independence and can even contribute to premature death. A host of factors can contribute to fall risks. Okay? Falls can also be caused by impaired vision or balance. Oh, I didn't mention yoga before in the exercise recommendations, but yoga is actually something that can really help you with balance. I didn't mention it before, but add yoga to your list of exercises to include in your routine as well. It can help with balance and help to prevent falls. Okay, sorry, lost my spot here. Okay, falls can be caused, by loss of muscle mass, chronic or short-term illness that impair mental or physical functioning. Can also be caused by the effects of certain medications, including sedatives, tranquilizers, sleeping pills, antidepressants, anticonvulsants, muscle relaxants, and even some heart medications. The use of 4 or more prescription medications has been shown to increase the risk for falling. Drinking alcohol is also another risk factor. If you have osteoporosis, it is important to be aware of any physical changes you may be experiencing that affect your balance or gait, and to discuss these changes with your doctor and other healthcare provider. It's also important to have regular checkups. Tell your doctor if you have had problems with falling, dizziness, anything that you think may be a risk factor for falling. The force or impact of a fall, and how hard you land, in other words, plays a major role in determining whether your bone will actually break. Catching yourself so that you land on your hands or grabbing onto an object as you fall can prevent a hip fracture. You may break your wrist or arm instead, but the consequences of those breaks are a lot less serious than if you break your hip. Falls can also be caused by factors in your environment that create unsafe conditions, low lighting, rugs that aren't, maybe the edge of the rug is flipped up and that can cause you to trip, objects on the stairs. All these things can actually increase people's risk of falling, especially as we get older and our eyesight maybe starts to decline. Okay, so these are some ways to fall-proof your home. So keep halls, stairs, and entryways well lit. Keep the floors clear of clutter. Use night lights in rooms, or keep a flashlight by your bed if you think you're going to get up in the middle of the night to help you make sure you see where you're going. Use non-skid rubber mats near the sink, the bathtub, and in the shower. Install grab bars on the bathroom walls. Install handrails on steps. If you're using a step stool, use a sturdy one with a handrail and wide steps. Better yet, keep things within arm's reach so you don't have to use a step stool, because using a step stool, the higher up you are, the harder you're going to fall. So if you can prevent yourself, keep yourself on the floor, you're better off. Okay. There's actually, and I'll send this in the follow-up materials, there's a, like an audit you can do of your home to assess fall risk factors. So I can send that in the follow-up email after this presentation as well.
That would be great. That would be very helpful.
Yeah. Okay, this is continued. Wear boots or shoes with rubber soles. Look carefully at floor surfaces in public buildings, which may be slippery or just unfamiliar, to you. Be careful on steps leading to front and back doors. Use a shoulder crossover bag, fanny pack, or backpack. That helps you leave your hands free so that you can hold on to railings and things, or if you do fall, your hands are free and can help to break that fall. Okay. And stop at curbs and check the height before stepping down or up. Okay, so really take a second to see, okay, how high do I have to lift my foot? Just takes a second to do that, and it can really help to prevent a fall. Okay, if you're someone who tends to wear shoes that don't have a back, those can actually increase your risk for fall as well. So try to wear shoes with a back. Okay. All right, for safe movement, these movements can tend to be unsafe and cause you to fall. So bending forward from the waist, sit-ups, abdominal crunches, and toe touches, twisting the trunk in extreme side or forward bending, reaching high or far out in front of you, and carrying packages that are too heavy. Okay. And that's all I've got. I have about 3 minutes before I have to get off and run to another program.
Okay.
I also have...
Yeah, quick questions, or...
I can take a couple of quick questions. I also have an evaluation, so if you wouldn't mind filling out an evaluation, I can put the link in the chat box, and you can do this after I leave if we need a few minutes. But that helps Rutgers to understand what audiences we're reaching, and also helps me understand if I should change anything that would be helpful about the programming that I'm doing.
Excellent. And like I said before too, I can also send that out later if people can do it now, or we can also send it and some of the great material. Thank you so much. I mean, some things you think about and you just, you have to remember to do these things. And I was saying to you before, my doctor recommended the bone density test. A lot of doctors now are they want a baseline.
Mm-hmm. Yes.
To evaluate how are you losing or are you losing over, I guess, the next few years. So that is an interesting thing. It's a very timely topic. So any questions before we have Jen for just a little while?
I put the link to the evaluation in there. I'm also going to put my email address. I will email you back if you email me questions.
But it was also what you were saying too, because I was looking at the Rutgers newsletter, the Visions newsletter.
Yeah.
I was saying like how the Mediterranean diet, like your diet really can help you so much. Mm-hmm.
Nutrition is something that I think we tend to undervalue in this country. Mm-hmm. Food is readily available, but not the right kinds of food in general, so the ones that are the best for us are, sometimes take the longest to cook or, not readily available, et cetera. So, yeah.
Your information on Prolia, I don't think is correct anymore. Maybe you should just see.
Oh, okay. I'll go back and check.
Yeah. I know they give injections now twice a year for Prolia instead of.
Yes. Yeah. Mm-hmm. They do. Yes. Did I not? I
put down daily injections.
Oh, I did. Oh my gosh. That was a mistake. I'm so sorry. Yes. Thank you for catching that. I'll correct that. Probably just a typo as I was going down. I'm sorry. Thank you for letting me know.
So do we have any other questions? And everybody does have the link to the survey. As we said, this is a wonderful program. Rutgers really does like to do this outreach program, and part of this is to find what topics us, the public, want and need and are curious about. So
yeah, exactly. And if you don't, the evaluation has a bunch of questions. Even if you can just answer the first two, which are quick multiple choice, that would even be helpful if you don't want to, fill out the whole thing if you have to run or whatever. Okay. Oh, someone said she's on their phone and doesn't see the survey. I think that Linda, you said you can email it out, right?
Absolutely. It's part of. I will email. I will do a follow-up email, as Jen was saying, throughout. She's going to give us some material, and I will do a follow-up email on this. We will put this also on our library's YouTube page. So as soon as our director puts it up, I will send out an email that would have that on it as well. Because again, you did cover a lot of information.
Yeah.
And it's hard to keep everything together and then to go back and you do always give us such helpful follow-up material.
Yep. Yeah. And I'll email, I can email the slides, but also some other handouts as well, like fact sheets.
Perfect. Perfect. Great. Thank you.
Okay. All right. I'm going to run. Thank you so much, Linda, for having me. Thanks to everybody for coming.
Thank you.
All right. Take care. Bye-bye.
Bye-bye. Thank you.
Okay, and as I said, everyone, I will send out a follow-up email. Thank you all for spending the afternoon with us. I'm going to stop the recording now.